So the first thing I would do is this. I would cut snacking. And I know that sounds small, but it isn't. It is massive because snacking helps the blood sugar roller coaster from running. It keeps insulin high. It keeps hunger and cravings alive. Now, here's the problem. The moment you try to cut snacking, your brain will say, well, what am I supposed to do when I'm hungry? What about 3 p.m.? What about the evenings? What about when I'm stressed? So here's a solution. And this is where people often go wrong. I would not cut snacking and then try to survive on willpower. I would cut snacking by eating meals that actually keep me full. For me personally, I focus on the meals because I have no interest in starving myself. I have no interest in feeling hungry. And I'm not interested in making this hard for myself either. So I would build my day around proper meals. I'd make sure they're satisfying. And I'd make one more decision that would help my pancreas rest, which is this rule that I have of no food after 7 p.m. That would be my last meal of the day. Not because eating after 7 p.m. is bad in some moral way, but because I'm looking at this through one lens. How many hours can I give my pancreas a break for? If I finish eating at 7 p.m. and I don't eat again until breakfast, that's 12 to 13 hours where my pancreas isn't dealing with glucose coming in. It becomes a rest window. Now, do keep in mind that if you are already taking medication that risk hypos, things like injecting insulin or tablets for diabetes, then you must speak to your own doctor, as I would not want you to risk blood glucose going too low overnight. But for everybody else with type 2 diabetes, getting the blood glucose lower is exactly what we want.